You know you probably ovulate right in the middle of your menstrual cycle, but are there ovulation symptoms that can give you a heads up? Yes, here are 10 signs that may predict when you're most fertile. Just before we get into it, don't forget to give this video a thumbs and subscribe for more health content. So what is ovulation? Ovulation occurs when an egg is released from one of your ovaries, typically once a month. The egg then travels down the fallopian tube, where it may encounter sperm and be fertilized. If fertilized, the egg moves to the uterus and implants, resulting in pregnancy. If not fertilized within 12 to 24 hours, the egg disintegrates, and you will shed your uterine lining during your next menstrual period. Your fertile window spans from 5 days before ovulation to 1 day after, as sperm can survive in your body for up to 5 days. The optimal time for conception is when live sperm are present in the fallopian tubes during ovulation. While it's possible to conceive without tracking ovulation, monitoring ovulation symptoms can increase your chances and potentially speed up the process. Understanding ovulation is beneficial not only for those trying to conceive, but also for women practicing fertility awareness to better understand their bodies. Though not a reliable birth control method, some use this knowledge to avoid sex during their fertile window to prevent pregnancy. Even if you're not actively trying to get pregnant, being aware of your menstrual cycle and ovulation patterns offers valuable insights into your reproductive health. So what are the signs of ovulation? Understanding and tracking ovulation symptoms can aid in identifying the best times for conception. While it's important not to obsess over the process, recognizing major signs of ovulation can be beneficial. Regular menstrual cycles often indicate a consistent fertile window, but irregular cycles may require medical guidance. Not all symptoms may be present, and absence doesn't rule out ovulation. Understanding your body's patterns is crucial for reproductive health and fertility goals. 1. Changes in basal body temperature. Basal body temperature, BET, is the lowest body temperature during a 24-hour period measured at rest. After ovulation, BB increases slightly by 0.5 to 1.0 degrees Fahrenheit, persisting until the next menstrual period with a minor dip before the rise. While BET charting confirms ovulation, it doesn't predict it. The peak fertility period aligns with the days preceding the BB increase. Consistent tracking over months with a basal thermometer is essential to establish patterns and understand your cycle reliably. 2. Changes in cervical mucus. Cervical mucus, a vaginal discharge, undergoes distinct changes in texture before and after ovulation. Production increases leading up to and after ovulation, peaking in quantity 2 to 3 days post. Ovulation. At peak fertility, the mucus becomes clear, thin, slippery, and stretchy, akin to raw egg whites. This consistency aids sperm movement toward the egg, optimizing conception probability, as explained by the American Society for Reproductive Medicine. Azerm. 3. Changes to the cervix. During ovulation, your cervix undergoes changes, becoming softer, higher, wetter, and more open. Regular cervix checks can help distinguish these differences, establishing a baseline for comparison. Using a clean finger to gently reach inside your vagina enables monitoring of these changes. Additionally, you may notice slight swelling and increased sensitivity of your vulva during ovulation, indicating your body's readiness for conception during this fertile window. 4. Cramping. Ovulation may lead to mild discomfort like lower abdominal cramps or twinges, often on one side, known as Mittelschmerz. Occasionally, this discomfort may manifest as low back or side pain, though less commonly. While not all women experience ovulation cramping, for those who do, it typically doesn't significantly disrupt daily activities. The sensation can vary from dull and achy to sharp and sudden, lasting from minutes to hours or occasionally persisting for a day or two. 5. Spotting. Some women may experience light spotting or bleeding around the time of ovulation, attributed to the rupture of the follicle surrounding the egg. This bleeding can appear red initially and darken to a brown hue over time. Both red and brown discharge may be observed during this period, with spotting occurring suddenly or persisting for a few days. This spotting serves as another potential indicator of ovulation within the menstrual cycle. 6. Breast tenderness. Following ovulation, the surge of hormones, particularly progesterone, can lead to changes in breast sensation. Many women experience tender, heavy, and achy breasts during this phase of their menstrual cycle, accompanied by soreness and tenderness in the nipples. These hormonal fluctuations contribute to heightened sensitivity in the breast tissue, which is a common occurrence for many individuals post-ovulation. 7. Heightened sense of smell. Studies on the relationship between ovulation and sensory perception, particularly smell and taste, have yielded conflicting results. However, some research suggests that women who are ovulating or in the second half of their menstrual cycle may exhibit a heightened sense of smell and taste compared to those who aren't ovulating. While the exact mechanisms behind these changes remain subject to further investigation, anecdotal evidence and certain studies indicate a potential correlation between hormonal fluctuations during the menstrual cycle and alterations in sensory perception. 8. Increased sex drive. Leading up to and during ovulation, many women experience an increase in mood, confidence, and feelings of sexiness, flirtatiousness, and sociability. This anecdotal evidence is supported by studies showing heightened libido during ovulation, aligning with the natural reproductive cycle rhythm. The surge in libido often coincides with the production of luteinizing hormone, LO, and spans approximately 6 days, starting about 3 days before the H peak, occurring roughly 24 to 36 hours before ovulation. During this period, research indicates stronger sexual desire and more frequent sexual fantasies, highlighting the connection between hormonal fluctuations and sexual behavior. 9. Changes in appetite or mood. Before ovulation, a decrease in appetite may occur due to elevated estrogen levels, suppressing hunger. Conversely, after ovulation, increased progesterone levels often lead to heightened appetite. Studies show significant differences in caloric intake between the menstrual cycle's first and second halves, with some research indicating a rise in daily consumption ranging from 90 to 504 calories post-ovulation. Additionally, evidence suggests that women are more likely to experience positive moods around ovulation, theorized to be linked to the production of luteinizing hormone, LH, and follicle-stimulating hormone, SHE, and follicle-stimulating hormone. These hormonal fluctuations may contribute to increased well-being and positivity during this menstrual phase. 10. Fluid retention. Hormonal fluctuations around ovulation can cause bloating. Before ovulation, increased LH and estrogen lead to fluid retention, while post-ovulation, progesterone slows digestion and increases gas production, exacerbating bloating. Fortunately, this discomfort typically lasts only a few days, aligning with hormonal shifts. Understanding these natural changes can ease concerns about temporary bloating during the menstrual cycle. When does ovulation happen? Understanding your menstrual cycle is essential for fertility awareness. Typically, ovulation occurs midway through the cycle, around day 14 for those with a 28-day cycle. However, cycle lengths can vary from 28-day cycle. Cycle lengths can vary from 25 days, making ovulation prediction challenging for some. Not ovulating means pregnancy cannot occur, as there's no egg for fertilization. This condition, termed an anovulatory cycle, can result from pregnancy, menopause, or birth control pill usage. Factors such as the following may also inhibit ovulation. Sue recently had a baby. He had a certain disease or condition, such as polycystic ovary syndrome or premature ovarian failure, are very underweight or overweight, are experiencing stress. See you take certain medications, some antidepressants and anti-nausea medications, for example, are exclusively breastfeeding. Your baby eats no solid food or formula. How to calculate ovulation. Predicting ovulation with absolute certainty can be challenging, but several methods can help you estimate when it's most likely to occur, allowing you to plan intercourse or intrauterine insemination, IUI, accordingly. Combining multiple methods can enhance your accuracy and increase your chances of conception. Here are a few approaches you can consider. 1. Ovulation test kits. Using an ovulation predictor kit, OPE, is a convenient way to identify your fertile window. These kits, available over the counter without a prescription, come in 2 types: urine tests and saliva tests. Both show a positive result in the days before ovulation, helping you plan intercourse for optimal chances of conception. Testing at the same time each day is recommended for accurate results. 2. Fertility monitors. Fertility monitors offer a comprehensive approach to tracking ovulation by monitoring various fertility signs like basal body temperature, BBA2, cervical mucus, and urine tests. These monitors analyze the collected data to identify your most fertile days on a monthly chart, simplifying the process of pinpointing ovulation. They prompt you when to perform urine tests, record you when to perform urine tests, record menstrual periods, and track sexual activity. These monitors come in different forms, including smartphone apps and separate touch. 3. Ovulation calculators. You can use Ovulation Calculator to find out which days you're likely to be fertile and what your due date will be if you conceive. It's one quick and easy way to figure out how to increase your chances of getting pregnant. 4. The calendar method. If your cycle is regular, the same number of days each time, you can try the calendar method, also known as the standard days method or menstrual charting, to estimate when you'll ovulate. So, find your expected ovulation day. To do this, count back 14 days from when you expect your next period. Now, calculate your fertile window. This includes the day you ovulate and the preceding 5 days. So, for example, if day 1 is the first day of your period and day 20 is the day before you expect your next period, you'd be fertile on days 9 through 14. Emphasize the last 3 days. You're much more likely to get pregnant during the final 3 days of your fertile window than during the day immediately after you ovulate. Although sperm can survive in a woman's body for up to 5 days, they're more likely to fertilize your egg within 3 days of having sex. This method is the easiest way to estimate your fertile window, but it's not always accurate. For one thing, you may not know when your next period will start. For another, ovulation doesn't dependably happen exactly 14 days before menstruation. 5. Your ovulation symptoms. Tracking subtle changes in basal body temperature, cervical mucus, and cervical firmness over several cycles can help predict ovulation. Noting these cues on a chart or app may reveal patterns, aiding in future ovulation prediction. However, irregular periods may obscure these patterns. While charting is cost-effective, it requires time and accuracy. Additionally, being aware of other ovulation symptoms like spotting or cramping can complement ovulation tracking methods. While not precise, recognizing these symptoms enhances fertility awareness. Understanding ovulation signs can significantly impact fertility journeys, providing insights into body rhythms and optimizing conception chances. For more health-related content, consider subscribing to our YouTube channel, and if you like to support our health outreach, kindly check the link in the description of this video. Stay informed and join the community to receive the latest updates and support on fertility and reproductive health.